Can see you, but we can't see you, huh? Right. Oh, wow, we're live. Is that how you feel, Taryn? You just hit the live button. Welcome to the Chicken Box. I'm your host, Impeccable. I wasn't even looking at the countdown. I'm talking backstage. Hope you're having a fantastic day. Hope you had a great holiday. Didn't eat too much. You started your exercise plan like me yesterday after just filling up on so much food after the great holiday and spending some time with the family. This is the Chicken Box. Yeah, if you're from the Baltimore area, you really do understand what a chicken box is. It's 4 wings, it's fries, it's salt and pepper, it's ketchup. It's a greasy treat that I don't eat anymore, but I love. I like to just smell it. Just every now and then you want some fried chicken. It's hard to turn it down. Dr. Draper, CEO of Afro, how are you today?
I'm good, and it's hot sauce, depending on who you talk to. I
Absolutely.
am well, Impeccable. I am glad to be back on the box. Where we say, "Don't be a chicken, get on the box." And so we have a wonderful show lined up for today. It's being broadcast live on Facebook and YouTube. Is there another platform as well? I know at least those two. And so
LinkedIn. Yeah.
LinkedIn. So if you're on any of those now, come on and share, invite people to come on for this conversation on today. Good to see you.
And Ashley Fields. We all represent different generations here. I'm Gen X. Dr. Draper is a boomer millennial.
That's right.
And Ashley,
From
hailing
DC.
from DC.
Yes.
You're Gen Z. Gen Z from DC. She holds down the fort on our DC office. We have a fantastic topic today, everybody. We're talking about prostate health. I think everybody, let me just say, I think every man, and at least black man, should really, really pay attention to this show. And I really need you to share this with somebody because I don't know about everybody's family, but I know in my family that it has hit our family, and if we could have caught it a little sooner, is what everybody says. Maybe, especially with technology and modern medicine now, it may have been a chance. So I don't know who who needs to hear this message, but this is the message. We're powered by the oldest black business in Maryland, the Chicken Box, the Afro-American newspaper. 131 years of educating, informing, and inspiring people of color, not only in the Baltimore, D.C. area, but around the globe. We have some fantastic guests. I'm going to ask Ashley if you would introduce our guests because I am anxious to jump into this conversation about Black people versus prostate health. Ashley?
Yes, this is a very important topic today. I'm excited to get into it. My grandfather, who is struggling from prostate cancer, is actually, he was in the hospital over Thanksgiving. So just praying for him, excited to get into this discussion and make people aware of how important it is to make sure your prostate is up to date and in health. So first we're going to kick it off. We have an Aggie on here today. So anybody representing blue and gold, make sure you're commenting in the chat. That is Mr. Thomas Farrington, and he founded the Prostate Health Education Network in 2003 following treatment from prostate cancer in 2000. So he's been doing work to help other survivors, and he also released a book called Battling the Killer Within in 2001. So he's been using his own personal experience to make others aware of what goes on. In addition to that, we also have, give me 1 second, sorry about that disruption, Mr. Penn. Let me get that.
Mr. Dave Russell.
Okay. 1 second. Here we go. We have Mr. Russell. He's a board-certified urologist and senior medical director on the prostate cancer team at Pfizer. And he received his degree from Georgetown University School of Medicine in 1988, right here in the district. And he also did residency at Albany Medical Center in 1993. So welcome both of them today. I'm excited to get in our discussion.
Absolutely. Tom and Dave, we got two people on. Usually we have one guest, but it's so powerful of a conversation that we had to have two on. So, Tom, I'll start with you to give you the better introduction of what you represent, the president of FinNet, the Prostate Health Education Network, and just what your mission and passion is.
Absolutely. It is a pleasure for me to be with you today, the Afro News. And just let me say, Mr. Impeccable, that I'm not from Baltimore, I'm from North Carolina, but we know what chicken boxes are in North Carolina.
All right. Talk to me a little bit, Tom.
we had the chicken wings. Sometimes we got the leg thrown in there too. So we know all about those chicken boxes. As Ms. Fields said, I am an Aggie, North Carolina A&T, Aggie Pride. And so it's good to be with you all today again. I am a 23-year prostate cancer survivor. And, that's a long time to survive prostate cancer, but I've done it. And I've done it in pretty good health throughout that whole 23 years. But I did lose my father and both my grandfathers to prostate cancer. And I was diagnosed with prostate cancer. My father died from prostate cancer on Christmas Eve, 1999. And I was diagnosed with the disease in March of 2000. And when I was diagnosed with the disease, after experiencing my father and grandfather's passing, I really didn't know anything about prostate cancer. And, when I realized that I was not too smart. I thought I was a pretty bright young man at that time, but realizing that I had watched them pass and didn't know anything really upset me. So while I was in treatment for the disease, I decided that I was going to do something about prostate cancer awareness. And I began to write my book, Battling the Killer Within, and I released it in 2001. And that set me on the path that I've been on since then as an advocate to raise awareness, raise knowledge within the Black communities. And we've done that throughout the country. FIN is a leading patient education and advocacy organization focusing on the need of Black men as it relates to prostate cancer. So we've done quite a number of programs. We have programs throughout the country now, and I'm looking forward to providing more information on those. So
welcome to the Chicken Box, Mr. Tom Farrington, reigning from North Carolina, HBCU proud. Glad to have you on the show. Joining you today is Mr. Dave Russell from Pfizer, who is the lead. You told me again. Tell me again, Dave. The lead.
Yeah, the global medical lead for prostate cancer.
Global medical lead.
Yeah.
We're getting all into the technology. We don't know much about prostate cancer, but now we need to know about the people who are helping. So, Dave, just give us just a little synopsis about what you do, and then we'll get into a conversation. Please put in the chat, guys, if this is resonating, and please share, because somebody's family needs to hear this information about prostate health and not just about cancer.
Yeah, for sure. I love Chicken Box. So good. They had to give it 2 X's, right? So no. So thanks, Beck. Well, I'm a urologist, as was mentioned. And urologists are the primary doctors that treat prostate issues in general, prostate cancer specifically. And I treated a lot of it in my practice. And, the saddest thing for me in practice was having to tell men who were diagnosed with cancer that the cancer had already spread beyond the prostate, because when it's contained within the prostate, i.e. when it's caught early, it's incredibly treatable. And men should be cured of cancer for the most part when the prostate cancer is caught early and contained within the prostate gland. Unfortunately, I had a lot of patients that came my way that the prostate cancer was diagnosed later and it was already out of the gland. And then the number of treatments years ago were limited. So, there wasn't a tremendous amount we could do. We could treat it, but the treatments didn't last forever. And so that was very sad, knowing that this was a man that maybe if he had come into the office a year or two earlier, we'd be having a totally different conversation. I joined Pfizer because we're working on drugs that will help address this need for the treatment of men that have more advanced disease. We know we can take care of it when it's early, and that's what we want. We want men to get screened. We want men to get this caught early. The only thing you have to fear is not having it caught early. That's all you have to fear. You don't have to fear the screening and all of that. But I joined Pfizer because we know a lot of men aren't caught at this early stage. And I was very passionate about helping to develop medications and things that would help men who were, beyond the stage where surgery or radiation would take care of it. So that's my background. And what Tom and I are here for is to get as many men, and certainly as many Black men as possible, into their doctor's office for screening. Screening saves lives. Bottom line, screening saves lives.
Welcome to the show, Dave and Tom. We are talking about prostate health, and it is a hot topic.
Mm-hmm.
Whether you think it's hot or not, it is hotter than the chicken grease that fries on the chicken box. And if you don't wake up, fellas, you will end up with the bad news of we didn't catch it before it spread. And so what do you think? Let me start with you, Tom. What do you think is the biggest trepidation of men even getting tested for prostate health?
The biggest issue is lack of knowledge. That really is the biggest issue. All Black men are at high risk for prostate cancer. So that should be the number one thing that Black men are aware of. You are at high risk for prostate cancer. We don't know why. Medicine doesn't know why. But that is a fact based upon the statistics. So knowledge about early detection is important because as Dave pointed out, early detection saves lives. Not only that, it saves a lot of treatments. It saves a lot of issues in dealing with prostate cancer. As I said, I'm a 23-year survivor. And, I have lived a relative good life with prostate cancer. And most of that is because I caught the disease relatively early. And the other thing that men need to know is that, early detection doesn't mean an invasive test. Years ago, when we talked about early detection, we talked about the physical examination. And a lot of men said, well, hey, I don't like that exam. I don't want the doctor performing that exam on me. But today, the recommendations are that we start with a simple blood test. That simple blood test will let you know your increased risk for prostate cancer. If I have a blood test that's out of range, then, I need to get other tests. But if I don't, at least I can monitor my prostate health. And I think you said it perfectly when we opened. We need to talk about prostate health. And early detection screening allows you to monitor your prostate health. So those are the things that are critical. We've done a lot of work in raising awareness about early detection. In fact, we've created what we call Dr. PSA. And we have a portal that really focuses on early detection screening. And it's at finpsa.com. And I think that Taryn indicated, I put that up, Taryn, and you can actually click that link, finpsa.com.
Absolutely. Great information. Is it Dr. Russell or is it Dave?
Yeah, it's Doctor, but it's Dave.
Like to see
It's
Doctor.
Dave.
This is a stream. We'll change the name on the screen. So when people see Doctor, for some reason,
even my patients call me Dave. I like to a little more intimacy. But anything. Dave's fine.
I'm going to call you Dr. Russell. You are an authority on the subject. So I do want to honor your work that you've put in. Can you walk us down the road of what it looks like for a person who didn't ever get screened? They never wanted to, a lot of men do not want to, like Tom said, they did not want to bend over on the table and just do whatever they thought was going to happen. And they just, that might have been a lot of the reasons for a lot of the guys, but talk to me from what it looks like and what it looks like in your body and what a patient is going through once it has already begun to really take control of your body.
Yeah, no, that's a great question. Yeah, first of all, I agree with everything Tom said, and we are incredibly fortunate as men to have a test, a screening test as easy as a blood test. So you have your blood tested for whatever else you're having it tested for, cholesterol, blood sugar, glucose, whatever. PSA can get added to that, and it's as opposed to women that have to have mammography, or men and women that have to have colonoscopy for colon cancer. In relation to that, prostate cancer screening is really easy. So there's no excuse not to have it, because it's that easy. For the men that don't, and they have the misfortune of developing prostate cancer, and it goes undetected, and it spreads. It's really, what it tends to do is it goes to the bone. So prostate cancer has an affinity. It likes to go and lodge in bone, and as it grows with time in bone, it is incredibly painful. Listen, I treated a lot of patients with different types of cancers, and the bone involvement of prostate cancer is about about the most painful thing that anyone would experience in any form of cancer. We do have treatments for that. We can help alleviate some of that. The problem is the treatments don't last forever. So, that pain that you're experiencing, or the symptoms that you're experiencing, we can help with that. And we are working diligently to get better treatments and better ways of handling it. But men don't have to have that be the case. That's the
what's the pain that a person has to go through? I mean, like what is the man experiencing once he's been diagnosed with this prostate cancer?
So early on, there was almost no symptoms. So see, that's why screening impeccable. That's why screening is so important. Because if you're waiting for something to happen, it's too late. Don't wait for symptoms. Yeah, you might have some urinary symptoms. You might notice that you're going much more frequently, or you're getting up at night, but that's not cancer. Usually that's just, as a man gets older, the prostate gets larger, and that's usually what causes that. So I always tell people, don't be waiting for symptoms to occur, and then you say, you know what, I got to get this checked out. I'm having some of these problems with my urination. Don't wait for that. The screening should just occur based on age. We do have age parameters that we use for screening, but we don't wait for symptoms, because again, you want to catch it before it becomes a real problem in terms of spreading beyond the prostate. Once it's spread, so the bone pain that you get, this is the kind of pain that we're using really, really powerful, opioid drugs to try to control it, like morphine, etc. You just don't want to get there. That's the bottom line. And you don't have to get there. That's the sad thing about prostate cancer. Every patient that I saw that missed their diagnosis, it was preventable, and that's just very sad to see that, and and it's just something as easy as a blood test. So
absolutely, this is the Chicken Box. This is we're talking about prostate health. I'm going to bounce past it to our CEO, Dr. Draper, and
I have so many questions I want to ask. Some of them are really basic. So, what's the age appropriate time for? What are those benchmarks for that? And I'm really curious if you, Dave, or Tom can talk about, why are Black men more susceptible to prostate cancer? It seems like the statistics say that Black men are more susceptible. I can't even say the word, to the disease. So curious about those two things.
Tom, I'll let you do the age.
Sure. 1 in 6 Black men will be diagnosed with prostate cancer. And as Dave pointed out, the key thing is early detection. Black men are diagnosed with prostate cancer at a rate nearly 80% higher than that for white men and men of all other racial and ethnic groups. But we die at a rate more than twice that of these other racial groups. So the disparity is at two levels. The disparity is at the incidence level, and then the disparity is at the death rate. So we recommend the primary guidelines recommend that all Black men began to talk with their doctor and begin screening at age 40. And you know, the early detection screening guidelines have been very controversial over the last couple of decades, and you all may have seen something about those controversies. But in recent years, I think it's been pretty widely accepted that early detection screening save lives. And even though there is still some debate about when you should begin testing, we recommend, and some of the major guidelines like the National Comprehensive Cancer Network, the American Cancer Society, and even the American Urological Society recommend that you begin this whole process in your 40s. So that's important. The other thing I'd like to point out about that is that prostate cancer caught at the early stage, the 10-year survival is more than 90%. 10-year survival is more than 90%. Caught at later stages, that 10-year survival dropped down into the 30 percentile range. That is a big difference. I mean, that in itself should cause every Black man to say, hey, let me get my simple PSA blood test. Because if I can get that, and if I may be diagnosed with prostate cancer, but if I get it early, after 10 years, I can be in that 90 percentile range. And again, I would say after 20 years, I've never had to take those drugs that they spoke about for pain. I've never had pain from prostate cancer. But I have seen many men die. And as I mentioned, I saw the men that I love most, my father, my grandfathers, died from prostate cancer. So early detection and managing that process is so very critical. Now, that's a long answer to the question of about the disparity and why, but I just want to point out that there are two. One is the incidence that has to do with early detection and where you catch it. And then the other one has to do with that death rate, which is more than twice. And that death rate, again, goes back to a great extent to when you catch prostate cancer. And then also about your knowledge about treatments. There are, we're blessed with many treatments for prostate cancer. The company that Dave is with, Pfizer, is one of the first early companies to develop a new treatment beyond the regular hormone therapy some years ago. And they continue, and many other companies continue to develop new treatments. We see a lot of new treatments for prostate cancer. And those treatments are life-saving. So knowledge about your treatment options are critical. And that is why that we at FIN, we have two portals. One is for early detection, finpsa.com, and one is for treatments, finpath.com. And I would encourage all your listeners to go to those sites for more information.
So that was, what a great answer. We're going to come to Dave because he's going to, I think, talk a little bit more about why Black men. But it also begs the question, and maybe I'll come back to this. Just remember, I want to talk about this, promoting prostate health, even with children and women, because sometimes they're the ones that can prompt dad and granddad and uncle to get the test done. Dave, you want to talk about the other question?
Yeah.
Yeah.
Thanks, Tony. Yeah. Tom said it so well. We've got these two sort of things that are going on. One is Black men getting prostate cancer, the incidence diagnosed with it at a higher rate. So why is that occurring? As Tom had said earlier, when first coming on to the podcast, we don't exactly know why that is, but there are things that we think are involved in that higher risk for Black men. So one thing that we do know is that there's a connection with family history. So it's not surprising that Tom had a father and a grandfather, and then he also developed prostate cancer because there is that familial link. There is a family link. So we know that there are some genetics involved. There are genetics involved in increased risk of developing prostate cancer. But there are other things that are probably, sort of working with that, like diet, high fat diets, and things like that. But we don't know exactly how all of that plays into the risk for developing it. But we know that there are those risks are higher in Black men than they are in Caucasians. But then the second half of that is, once you're diagnosed, Black men are dying at 2 to 2.5 times the rate of white men. So why is that? Is that, again, just because Black men have a much more aggressive form of prostate cancer? And, it appears that in general, Black men do not have more aggressive prostate cancer than their white counterparts. There may be genetic differences. There may be some genetic differences, etc. But in the case of dying at a higher rate than white men, that really has to do more with detecting it early. So that has more to do with access to healthcare, right? If you have good access to healthcare, if there are not disparities in your access to physicians who will be screening for prostate cancer, then you're much more likely to have that screening test done than if you don't have really good access to a physician or a healthcare system. So we know that disparities in access play a role in why Black men are dying at a higher rate than white men with prostate cancer. And then, as Tom also alluded to, even when it's caught at a later stage, then it becomes access to these newer treatments and that are available. And again, there is disparity there, and that gap has to be closed. It has to be closed, and that's part of the reason that we're here today is, if you can get men in and you can get them screened early, then the difference in death rates between whites and Blacks will start to disappear. The last thing I'm going to say is, do Black men, if they have a more advanced prostate cancer, do they not respond as well to treatments or respond as well to drugs that are used to treat prostate cancer? The answer is no. We've looked at this. Black men and white men get the same benefit from treatment and from drugs used to treat the cancer. So again, it really has more to do with disparities in access to the appropriate care. And that's a gap that's important to close. And honestly, you hit the nail on the head when you talked about family and friends. And when that was mentioned right at the onset of this podcast, it's family and friends play a big role. They play a huge role because on their own, men are often just not the greatest patients, just not the greatest people to seek out healthcare. But a family member or a close friend will often get a man to do what's right and get into their physician and get screened. So that's a big element to improving rates of screening for Black men, is to engage the community.
Absolutely. Thank you very much for those responses. You guys, if you just tuned in, it is very important to share this message with all of your Facebook friends, Instagram, all of your friends, period. We're talking about prostate health. We're talking about screening. We're talking about how it affects Black men disproportionately. and how the education or the miseducation is keeping us from doing a better job. Ashley, our Gen Z representative, I know I see your brain spinning, especially since you just shared with us about your grandfather. Coincidentally, Tom, my grandfather passed of prostate cancer as well. So, this is hitting home for not just me, but I'm sure a lot of other people who are watching now. So, Ashley, jump in.
Yeah, I just want to circle back to what Dave said about, making sure that medical research is being done to help close the gap. We had a great story on that on page C5 about a new study that's going to be done on about 500,000 genomes from African descent. But just guiding more into the conversation towards treatment, if we can dive more into chemotherapy and radiation. And also someone asked earlier about any treatments that are in clinical trial. I know Pluvecta is one. So Dr. Russell, if you could talk to us about that. Mr. Farrington, if you could talk to us about your experience in treatment that might have helped you and that you saw, really make sure that you were able to survive for the 23 years that you've been with yours for. So.
Yeah, that's.
I'm sorry.
Actually,
Go ahead, Dave.
Go ahead, Tom.
No. Go, please.
No, so I was just going to say the key to this, and I think Tom's going to tell you, he hasn't needed, and correct me if I'm wrong, Tom, he hasn't needed drugs for prostate cancer because it was caught early. So that's the key. If it's caught early, Ashley mentioned chemotherapy, and nobody wants to be subjected to chemotherapy. If the cancer is found much later, then of course it can be quite helpful, but you really want to avoid it if at all possible. So that is the key. If it's caught early, there are some decisions that need to be made at the time the cancer is diagnosed. So not all prostate cancers that are diagnosed are treated aggressively. Prostate cancer runs a spectrum, right? It goes from being very, very non-aggressive to being extremely aggressive. So we really are careful about not over-treating patients. So we take into account, what does the cancer look like under the microscope? A pathologist will help us to understand, is this a cancer that will probably not do anything within your lifetime, that you'll probably live the rest of your life with this without it being a problem? Or is this a cancer that's much more likely to be aggressive? So right from the get-go, decisions are being made. Right from the time of diagnosis, decisions are being made. If the decision is made because a patient is younger, they're going to have much more of a lifespan, the cancer looks like it could be a little bit more aggressive, or because of the span of life that you have left, this cancer could grow and become lethal. In that situation, the decision is made to treat it aggressively at the beginning after it's diagnosed with either surgery or radiation therapy. And those are the two ways that are what we call curative intent. Those are the two ways when a cancer of the prostate needs to be treated. Those are the two methods that are used to actually treat it. And the idea of either having surgery or radiation, and they're fairly equal in their ability to eradicate the cancer. The idea there is cure. We're gonna take this cancer out surgically, or we're going to irradiate it with radiation therapy, and that's going to be it. You will be followed for the rest of your life. You will be followed to make sure that there's not a recurrence or not something that's gone wrong, as Tom has been followed. But if it's caught early and it's treated with either surgery or radiation and it's cured, you will not have to go through other drug treatments later on down the line. So that's why the importance of catching it early. It really saves a lot of problems in the future. So Tom, I'll let you speak to it as well.
Okay, good. Actually, I'm going to take a long way around answering your question, and I'm going to hit on another area, because I think it was either you or Tony brought up the importance of family members, wives, and other loved ones playing a role in the prostate care for men. And it was my sister when I was diagnosed with prostate cancer. Uh, she knew more about prostate cancer than I did because she and my mother were the caretakers for my father. And she had interfaced with doctors. She knew about that there were options that I had no knowledge about. And so she schooled me when I was initially diagnosed and had no knowledge about the disease. And she forced me to read some articles and then really, based upon that information, select a treatment. And I chose a dual radiation program at that time. I chose to have a brachytherapy that was a seed implanted, followed by external beam radiation. That was not a widely practiced treatment when I was diagnosed in the year 2000. And that treatment worked well. I actually had a recurrence 9 years later, but it was not in the gland. It was in a lymph node. And there, by then, there was another treatment that was available called CyberKnife that was able to really just target that lymph node and to clear that out. And so those different treatments, and we talked about the importance of knowing your treatment options. Those different treatments have, kept me on a good path, and I still get a PSA test every 6 months. I still manage my prostate health. A lot of survivors, that we speak with say, "Oh, I didn't know after I had surgery. I didn't know after I had radiation that I needed to keep getting PSA tests." And I would say to all of the survivors out there, early detection of a recurrence is as important as early detection initially. So early detection throughout your prostate care and your prostate journey is important. And again, I would point to our finpath.com. We have information about all the different treatments based upon where you are when you're diagnosed throughout from early diagnosis to late stage. And it's a FinPath is based upon the treatment guidelines published by the National Comprehensive Cancer Network. And I would recommend that the listeners and the viewers really go to finpath.com for information of what you need to know about prostate cancer treatments.
Thank you so much. That was very, very helpful. All of this is really helpful, as Dr. Katrina Little Shaw just commented that this is a very robust discussion, and we have other people who are watching. So we want to say hello to those who are watching live now, and hello to those who will watch it later, because it will be still on the Afro social media on Facebook or Meta, but I don't think any of us are going to ever call it Meta. We all call it Facebook, on Facebook or LinkedIn or YouTube. And so we're glad that you're here. I know you want to be not called Doc, but Doc, I'm gonna call you that anyway. I'm interested and curious about your role at Pfizer, because you had a very robust practice as a urologist, and then now you're over with Pfizer and in charge of global. You have a global role, so yeah. Really want to hear a little bit more about that, and then I want to come back, Tom, and talk a little bit about. Somebody mentioned earlier about the importance of diet as well, and so what role diet has to play in your prostate health. And so let's, Doctor, let me hear from you first about your role at Pfizer.
Yeah. So thank you. When I was treating prostate cancer in the clinic, very rewarding. I absolutely loved my position there. But as I had mentioned earlier, you get these really sad circumstances where men are coming in late, or as Tom said, they have a treatment done and then they feel like they're cured, and then they really don't do the follow-up that they need to do. So what was really nice, or what is great about working for a company like Pfizer, is went from treating a patient at a time to treating thousands of patients at a time. And that was very important for me, because from around 1940 all the way up until, the 2000s, the early 2000s, treatment for advanced prostate cancer was pretty much the same that entire time. There were some small, advances, what have you, in terms of later stage prostate cancer. But it was basically stopping the production of testosterone in men. And testosterone is sort of like a fuel that fuels the growth of prostate cancer. So that was the mainstay of that was treatment for decades. And that's what I had to use when I was in practice. And then we started to get, other treatments. Chemotherapy came along, and then other forms of therapy. But it was clear that we needed much more. And the good news is that the treatment landscape has exploded in terms of the number of treatments that are either A, available now, or B, that are in development that will be available sometime in the future. So I wanted to be a part of that. That was, and I think sometimes people are a bit surprised to know, like, oh, pharmaceutical companies have doctors working there and scientists. Like, yeah, we are healthcare companies. So there's a lot of physicians at Pfizer. There's a lot of scientists at Pfizer that do sort of the basic research on these drugs, and physicians like myself that work on the appropriate way to develop them in terms of the studies that need to get done to prove that they are, in fact, effective, that they're safe and effective. So that's what I've been doing for now almost 23 years with Pfizer, and it's really just been it's been phenomenal. And it's the kind of thing where if you do something you love, you really feel like you're not working, although I do feel like I'm working a lot these days, but you really do, each day you get up and you think like, this is very rewarding, and it has been tremendously rewarding. But that was my rationale, and that's the reason I went over to the pharmaceutical industry, because I know that I can help a lot more men with this disease than I could as an individual provider. Thank God we have individual providers. They're incredibly important. Every patient deserves to have really good provider and good care. But I enjoy the fact that we can reach many more people with the products that we develop.
Wow. And we're gonna come. Thank you so much to you, Tom. You all have something in common with this 23 years.
Yes, it's true. Right. I never thought about that. Yeah. We were, and I've known Tom for a good number of years, but not quite back all the way to the beginning. But yeah.
Okay. All right. So thank you so much, Dave. So let me say hello. I saw some folk weigh in. Hello to Chippy, and hello to Carla. And then Craig has a question. We'll put your question back up. I think your question will be for Dave, but I want to go to Tom. Talk a little bit about the importance of nutrition, and either of you, and diet.
Well, there are a lot of studies that have been done on nutrition and exercise as it relates to prostate cancer. And, I think what's coming out is that good nutrition, good physical condition, and exercise is really important for health, including prostate health. Now, there have been studies to really see whether there are specific diets that would be beneficial in reducing the incidence of prostate cancer. I know lycopene from tomatoes is one, and there's been a lot of research around that. And every now and then you will see it doesn't matter. Then you will see something, maybe it matters. So those things for specific diets, we don't have data showing that if I eat this, if I stay within this weight limit, I can reduce my risk for incidence by 50% or 30%. We don't have that data. And I think a lot of research is ongoing to try to find those magic bullets. But as I said, it's always important that, good health, good diet, good exercise plays a role in good health.
Couldn't agree more. Could not agree more. Yeah. And I think part of the problem is there are so many elements and factors that go into prostate cancer. I know I mentioned there's genetic factors and other things that it becomes hard to select one thing. Like Tom mentioned, lycopene, and there's always been a lot of interest in that. It's one of the compounds in tomatoes, but it's so prostate cancer is so different in each individual that when you start looking at one thing that's a dietary supplement, it sort of gets washed out because prostate cancer is not exactly the same in everyone. So that's why it becomes more difficult to then, find the things that would really help the most. One of the great things about prostate cancer is that it's fairly easily diagnosed, and the cure rates or the treatment rates for early detected disease are very high. One of the things that's a little frustrating with it is for other cancers, we know about risk factors that you can do to reduce the risk of developing the cancer. Like the big one is obviously smoking and lung cancer. We don't have those same sorts of things that we can do with prostate cancer. And some of the risks that are associated with it, like race, are not something that you can modify. And then age, as a man gets older, the risk of prostate cancer increases. And again, well, that's not something we can modify. We all hope to get older. So that's just part and parcel of it. But yeah, Tom is right. There's not one thing that's been shown that we can do to really, change the risk.
Got it.
It.
Got it. So it's a pretty individualized both diagnosis and treatment. And I'm hearing you correctly early. One thing that is common across everything is early detection.
It's the common denominator. It's the common denominator. Yep.
That's real clear. So I want to put Craig, I think that Craig Talley had a question. That's his question. Speaking on the subject of either using drugs, like Lupron versus surgery, if you all can talk about that.
Yeah, no, it's a very good question. The drug, like I mentioned, that testosterone tends to fuel as a growth factor for prostate cancer. And what a drug like Lupron does is it basically chemically castrates a man. It takes the level of testosterone down to very, very low levels, which then impedes or slows down the growth of prostate cancer. We generally use that later in the prostate cancer journey. We don't usually use that up front. Now, there are times when Lupron is used during the course of radiation therapy to help keep things very controlled while the radiation is ongoing. But in general, it tends to be sort of an either or. And usually for early stage cancer that needs to be treated, because again, the cancer needs to be evaluated. And then those that need to be treated are usually treated with surgery or radiation, not just using Lupron alone. That comes later on in the process if things get out of control or if things have spread. So it tends to be sort of more of an either or. But a drug like Lupron does work very well by reducing the amount of testosterone in the bloodstream. But the frustrating thing about cancer in general, and prostate cancer specifically, is cancers find a way around these treatments. So they become what we call castrate resistant. That just means they become resistant to drugs. like Lupron over time. And that's why we're always working to develop new drugs that will help to arrest the cancer if it becomes non-responsive to a drug like Lupron. But if you catch it early, then you can avoid all those other things. That's the idea.
Early detection, early detection, early detection.
Yeah. Keep hammering that home, because all of the consequences of not catching it early are consequences you just don't want. You don't want to have to take these drugs for later stage cancer. You don't want, to deal with the symptoms that come with later stage cancer. As Tom said, if your cancer is out of the prostate, your 5-year survival, drops to in the 30% range. So it goes from in the high 90s down to in the 30%. And that's something we all want to avoid. So
Okay.
it is avoid.
I have a last question, then Ashley, you can ask. I'm going to kick it to you. I read a study, I think, it's been a while now, that says more sex lowers prostate cancer risk. Either of you want to comment on that?
I'm gonna let the doctor do that.
Okay. I think it was it a Harvard study? I forgot who.
Yeah. Well, nobody believed it at first, but that's been shown again. One of the problems with with these big sort of population-based studies is we don't know if it's cause and effect. That if there's something else about men who are having sex more often that would somehow lower the risk, that not just the sex itself. But having said that, it does appear that the number of ejaculations that a man has in a lifetime will reduce to some degree the risk of prostate cancer. It appears. Again, this is not a proven thing, but there does seem to be this correlation. We just don't know if it's cause and effect. What I will say about the prostate is, people are like, well, what is the prostate anyway? It is a part of the male reproductive system. So the prostate is a gland, meaning it secretes fluid, and that fluid helps sperm to prepare itself to get ready for inseminating a woman. So it is part of the reproductive system of a man. So it kind of makes sense that maybe there are some correlations between sexual activity and risk. And clearly, Tony, you're right. That study really raised a lot of eyebrows when it came out. But subsequent work that's been done still seems to show that there is that correlation.
All right, that might be good news to some.
I don't know, might be. Might be.
It could be. Ashley, I know we're almost out of time. And so what we do towards the end, and Impeccable had to hop off. For those who are watching, we're so glad that you are hanging in there with us. Ashley, you may ask a question if you like, or you can just jump on the box. At the last 5 minutes or so, we usually just jump on the box. You can talk about what we've been talking about, or you can talk about anything else that you would like to talk about. If Impeccable was here at the end of his being on the box, he would say, call a senior today. Don't text them. Call them, because they need to hear from you. I would say, call a man in your life that you care about today, and check in with him if he's 40 or over, and ask him about his prostate health, and has he gotten a screening? And if so, what did that show? Right? What did the screening show, and what's his next step? And so I'm going to get off the box. That's my last statement, besides the closing statement. Ashley, you are free to ask a question, or free to get on the box, or do both.
All right, I'll hop on the box. I'll just start by saying, Dr. Russell and Mr. Farrington, thank you guys both so much for joining us and sharing the information that you did. Watching a loved one going through this right now, I mean, this information is crucial, and we saw from the comments in the chat that this is affecting people across the nation. I know sort of before I had connectivity issues, we were talking about diet, and I just wanted to go back to that. It made me think about chemotherapy, radiation, and how those treatments affect you in other ways, and sometimes seeing hair loss in patients, and also seeing seeing them have a reduced appetite or seeing their taste buds see that food isn't, the same, doesn't taste the exact same, is something that I've noticed in my granddad. So I know that's something a lot of people might be, watching out for. But just in terms of providing more information, I did want to highlight PSAs because that's a term we used a lot on this call. I looked it up and it said that stands for prostate specific antigen, and that the numbers should be, at a medium range. And once they start increasing, that's when we're starting to see prostate cancer happen. And I believe they said that 0.7 was a good range for people who are in their 40s or 50s. So just wanted to highlight that. Maybe if anybody wants to mention that on the box as well too. But thank you guys for joining us. Anyone who's going through prostate cancer, we're praying for you. Thank you for joining us and spreading awareness. If you're on this call, please help us by spreading awareness afterwards as well too. This has been a great segment of the box, and I appreciate you both.
Thank you.
That's
Yeah,
great.
thank you so much. Thanks so much. And my last thing to say is, you can make a call today. You can actually change someone's life. That doesn't happen too often, or it's not quite that simple that often. But this is one of those things. You can call up a loved one. You can ask them if they've had this test done, if they've had it, and if not, and say, look, I love you, and I'm just telling you, you need to get this done, and I'll be really, really upset if you don't, and you can change someone's life. So let's hope your listeners do that. That would be great.
That would be great. Good advice.
I would like
You
to
get the final word there, Tom. You get the final word.
I'd like to jump on the box and grab a chicken wing and and say to the listeners and to those watching, what you need to know about early detection screening can save your life. And I invite you to go to finpsa.com. You will find a whole lot of depth, more detail about the things that we have been discussing today that will give you the information that you need to talk with your doctor about your prostate health. And you need at times, and I will say this to men, if you have not had a PSA test, a prostate cancer screening, and you're 40 or over, ask your doctor why, and let him know that you want to have a PSA test, and be very aggressive with that, because this again can save your life.
Wow. Thank you so much, Dave and Tom. This has been such great information. Thank you to those who've been tuning on Facebook, or on LinkedIn or YouTube. We're glad that you're with us on the Chicken Box. Again, this is powered by the Afro-American newspapers. We just go by Afro News now. We need your support, so we ask for that every time we're on the show. Go to afro.com. Sign up for a free newsletter. Somebody say free newsletter. Sign up, though, for a paid subscription as well. You'll get much more news, that including, as Ashley mentioned, our coverage. We've been doing a lot of coverage about prostate health and the prevention of prostate cancer in men, as well as other health-related issues. And so until next time, we want to say, don't be a chicken. Get on the box. Come on and advocate for prostate health for the men that you love. Ashley, we are praying for your grandfather. Tom, we salute you for your 23 years of survival. Dave, we salute you for your 23 years with Pfizer, as well as your time before as a practitioner. You're still a practitioner as such, as you said. Now you can impact thousands of patients. Thank you, Taryn, who's backstage as our producer. And so until next time, as Impeccable would say, I've already said it, call a senior if they want to hear your voice. Take care. See you next